Good morning. Yes, echoed a bit, didn't it? Good morning, everybody. Welcome to today's meeting of the Police and Crime Committee. Our main item of business is discussion with Lib Peck. Welcome, Lib, this morning, Director of the Violence Reduction Unit. We have some formal business to cover first. Again, welcome to members of the public today. Please, colleagues, turn your phones to silent. Those that wish to follow us on Twitter, please do so at London Assembly, #Assembly Police and VRU. Item 1, apologies for absence.
Thank you, Chairman. Apologies have been received from Assembly Member Arbour, for whom Assembly Member Goff will be substituting today, and Assembly Member Duval, for whom Assembly Member Shaw is attending today.
Welcome, Nadia. Thank you. When Andrew's seated, welcome, Andrew. Declarations of, it's going to be one of those mornings, though. Declarations of interest. Can I ask the committee to note the recommendations and, as ever, declare any other disclosable pecuniary interests that are not therein detailed? Thank you, colleagues. Item 3, can I ask the committee to confirm the minutes of the meeting on the 6th of March to be signed by me as correct?
Agreed.
Item 4, can I ask the committee to note the complete and ongoing and closed actions relating to previous meetings? Thank you. Item 5, can I ask the committee to note the action taken by me under delegated authority set out in the report and our letter to the Mayor on tackling neighbourhood crime? And item 6 is, can I ask the committee to note the response from the Mayor to our letter on the new model for preventing violence in London, which we'll be discussing this morning, which is quite a nice segue into the main item of business, which is discussion with Lib again. Welcome, Lib, and I'd like to welcome you to the meeting today. This meeting is specifically on the subject of the Violence Reduction Unit. Members of the public and others will know that we do cover a range of other issues, and we'll be publishing our work programme about items and issues that are important to Londoners very shortly. But today is particularly around the Mayor's London Violence Reduction Unit, and I'll set the scene with some questions. So, Lib, vision for the VRU. Can you briefly set out your strategic vision for the Violence Reduction Unit, please?
Yeah, sure. The sort of main objectives of the unit are really to try and tackle violent crime. It's violence in its entirety, not just knife crime, albeit that knife crime was actually probably the prompt to set up the unit. It's to really delve into the causes using an evidence base and in establishing that to make sure that we bring together public sector partners to really intervene at those critical moments of people's lives, to try and divert them from I suppose potentially either getting caught up in violence, either as a perpetrator or as a victim. It's classically referred to as a public health approach, although I do think there are probably many different definitions of what that actually means. But in essence, I think it's the data-driven nature of it, the multi-partnership working, and absolutely critically, the community and young people's voice at the heart of any solution. So looking at what we want to see, and I suppose getting to the vision, if you were looking back in 10 years' time, what you'd want to see is a society where violence was not accepted as a norm, that young people and Londoners felt safe, felt they were part of a inclusive and tolerant city, and that there was a real marrying between the actual and the reality of what people faced.
Okay, thank you for that. And we'll get on to later that there is some comparables with the Scotland model, yep, which you study. You'll know that this committee visited West Midlands to find out about their model, and we'll also refer to later the VRU steering group and the papers that were published a couple of days ago for tomorrow's meeting. We'll get into some depth around that. But what are you laid out the vision? What are the immediate challenges to that vision, and why would this not be a model or an approach that would have already been in situ already? What is new and what are the challenges, if you could briefly?
Okay. Well, I mean, I think what we're doing at the moment isn't quite breaking through, is it? I think that's probably what we'd all accept. We've seen a rise in crime since 2014. We saw an acute rise in knife crime from 2018. And I think, it's incumbent on all of us, and I do genuinely mean all of us, and welcome this opportunity to come and talk to all of you and work with all of you to try something slightly different. Now, there are elements of it that are no different at all. We know that prevention and putting money into preventative isn't, it's pretty much common sense, really. But there are other elements of it, and there's also good work going on, I think, both within London and you've already referred to across the country, which we want to be sort of drawing together and promoting more. But at essence, we need a bit of a systems change. I think we need to sort of try things a bit differently. We need to be looking at different models to try and crack something that I'm sure we all are very concerned about. So it's really, I think it's the very deliberate way in which we're looking to try and get partners around the table to reprioritise violence within their organisations, within their strategies, and working together effectively to make those kind of interventions I was talking about more meaningful.
On the strategic level, Scotland's approach has been for some time. It's a 10-year commitment, I understand. With a long-term political and financial commitment, which I guess is needed. Is that something that the Mayor will be looking to deliver from a long-term point of view?
I think it's both short-term and long-term. If you want me to reference Scotland first off, I haven't been to Scotland, but there are representatives from Glasgow who basically sat on the partnership reference group, and a lot of the thinking before I started in post had been done with through discussions with some of the people most involved in the Glasgow model. And obviously I think that's the thing that's had a lot of profile in the press, and rightly so, because it's done some fantastic work. But I think, I'm under no illusion that, London isn't Glasgow. There's a 600,000 population. There is a series of coherence around all the agencies that you need to be working with. London is a much more complex context in which to be working, both in terms of the number of organisations that there are, the ethnicity and the diversity of Londoners as opposed perhaps to Glasgow. And also I think there are other things to learn. Glasgow started off very much with a kind of quite hardline enforcement approach, and then sort of moved from that, if you listen and talk to the Glasgow workers, and then really developed an approach that got the community on board. I think we're very clear here in London that nothing works unless you've really got the community at the heart of it. So there are both differences in terms of context and differences in terms of the way we would want to work. So in terms then of short-term, long-term, I think we're looking at both. I think there is a real public appetite to change what's happening at the moment. There is quite a lot of excitement from people I talk to about adopting a public health approach. A lot of energy outside the organisations to actually get involved and do something. And I'm not saying that the VRU can provide all of those channels for people, but it certainly has a responsibility to do that. So that's very much the short term, and obviously we've got the budget to do that short term. And then in terms of long term, I think what we're really talking about is a cultural change. When you asked me to outline the vision, I looked 10 years hence and tried to look back, and you're not going to create that kind of cultural change unless you're doing it over a longer period of time.
Exactly.
It's unrealistic. So but I do genuinely think it's got to be both. I don't think we can just say, it's 10 years and then we're waiting for some change. I don't think that's acceptable.
I'm glad you mentioned about the comparable or lack of comparable with Scotland, because often some criticism around the concept was it was mentioned too often, and certainly in another place and here, that the Glasgow model is different. Things to be learned, they were effective, and we can learn from that model. But as you said quite rightly, I'm pleased you did, is London isn't Scotland. There's a whole different dynamic. You yourself had a previous community safety role in the boroughs.
London Council.
Tell us a little bit about your experience and how that's going to shape your role for this job of yours.
Well, I was on London Councils and as an executive member, I think from about 2014. So a year and a half after I became leader of Lambeth. As I'm sure you know, it's a cross-party organisation of the executive committee. I think there are 10 executive committee members, I think 7 are Labour and 3 are Conservative. We worked very well together, and the role that I had during that time was as crime and public protection. And that enabled me to represent the views of all London councils in City Hall about issues that we felt were really significant. And it was an important, as I believe local authorities are incredibly important actually, an important job to do. And I felt very pleased that colleagues, cross-party colleagues, had that had that faith in me to be able to do it. So
Okay, thank
learned a lot from it.
We're going to be asking quite a few questions about the work programme itself. About the signing off, and a little bit process at the beginning, so we can work this through. Has the draft delivery model, and I'll ask a supplementary question in a minute, been signed off by the mill? When is it going to be signed off and agreed? The model itself, because you've been talking now, we're in April, we chatted a month or so ago, there's a lot of conversation about the model evolving. When is the final model going to be signed off?
Sorry, just a clarification, do you mean the model as in the local delivery model that is obviously talked about a lot in the papers, or do you just generally mean the whole work programme for the unit?
Well, I assume it's really he's got to sign it because he's got some money to spend.
Yes.
There's 5 mil to be spending this
yeah.
year, which you want to get out the door. When is that going to start happening?
Okay, I'm not going to give you a precise date,
No.
but I can give you a sort of sequencing of the things that I think need to happen.
Yeah.
And the first is we need to agree the framework that is going to the committee on Wednesday. The partnership reference group that I've already referenced has played an important role, I think, in shaping up the work of the VRU, and has representatives from all of the public sector, the relevant public sector organisations. So that's an important starting point. You will note from that there is discussion about the local delivery model within it and some of the changes that we're beginning to sort of focus on and shape up. At that meeting, we will also be making sure that partners are clear about what their priorities are within that framework. So once we kind of get that sorted, I hope, then we are moving on very quickly to developing a kind of commissioning framework. And then, as you said, the challenge is getting money out the door.
Okay. So my last question.
You will notice. Notice that actually in the paperwork there's reference to commissioning principles. So the way in which we're going to try and spend the money, which was developed over a series of 3 practitioner workshops.
Okay. Good. I'm going to bring Peter in a minute. Then we've got quite a few questions about the actual, and Caroline as well. We've got some questions around the work programme itself. My last point really, and again we'll kind of blend into the other questions, is it's an evolving structure. I've seen the egg timer sideways into a bow tie sort of structure, because I've had briefings from Croydon, as you'd expect. And this was, up to yesterday, in my simple mind, a local hub predicated scheme. And I've got questions will be coming in about that as well. And the local hub, and I've actually got a draft alignment here of the hubs, and Croydon, bless it, as ever, was bullying everyone to be a hub, and was 6 boroughs. And the hub system predicated on the coverage of all of London, because you had 6 hubs and they had 4 boroughs already. It worked out. We read from the minutes, and other colleagues will come in a little bit later, we read from the minutes that the hub system has been dropped, and also a pan-London approach has been dropped. There will be some more questions, but could you just reflect
upon the thinking, basically,
reflect on the change, because that is quite a big change.
Yeah, it is quite a big change. I appreciate that. I mean, I would say that I wouldn't say sort of dropped. I think we're sort of evolving work. And I came in when some work had been already done on the model, and as you said, it had been variously described as an egg timer or bow tie. But I think I'm very clear that I need to talk to and listen to people on the ground and what they want to see happen. And the conversations I've had with community practitioners, the conversations I've had with members of the community, and I've met lots of community groups in the last 6 weeks, the conversations I had with the chief executives, which I did through London councils on one of their away days, was that there was a bit of reluctance about setting up a new structure in places where structures might already exist, and that's something I'm quite sympathetic to. I don't want to put in a lot of resource to setting up a structure which becomes a local VRU for the sake of having a local VRU. I think there's also a feeling that 5 million, while it's a decent sum of money, once you start spreading it all the way across London, actually has much less impact. That all of those conversations I have had, and certainly from my own experience actually of looking at funding distribution and sitting the different hat in a different place, is that you want to make impact. And you know, this as a project is about learning from where you know, things are really happening, and that what most people want to see from this unit is a clearer idea of what best practice looks like and how we can, and where it is relevant, learn from it. And so the sense for me of rather trying to set up a new structure across London takes money perhaps away from things that are already existing, and perhaps dilutes too much at this stage the learning, and that therefore the kind of local delivery should be a bit more focused in the first instance, and should be predicated on a very open and transparent criteria, which we're obviously working up, but would be really looking at the places most affected by violent crime and looking at where the greatest level of community engagement is at the moment, trying to draw from that lessons that then can be used across London. So that's really the kind of motivation and the thinking around it. I have to say it's not yet set in stone, and I apologise. I'm sure people want me to come here and be able to present everything all sorted, but it's not. It's evolving. It's an iterative process, and I think.
I think I can understand. Again, I think I can understand the fact that with 5 million across 32 boroughs, it could. The argument is it could be too thinly spread. And it may well be that you want to concentrate on certain models, test those models, see if they work individually.
I think so. I think that makes a lot, personally, I think that makes a lot more sense. And from the conversations I've been having with people, that's what they tend to feel as well.
But you're still going to have to speak across here, you've still got to have the boroughs to deliver on the local level. But
yes.
That still is the model, it's not this building delivering, it's going out to the boroughs to deliver. Okay,
absolutely. Sorry, I should make 2 points clear. You're absolutely right on that last challenge. Yes, it's the integrity of the model being that, you know, communities and local activity isn't going to be determined from City Hall. It is us supporting, enabling and promoting best practice that is happening and working with the existing structures, absolutely. And so that bit hasn't changed at all. Okay. It's just the way of doing it and the concentration of doing it. And the second thing is that obviously there will be some central activity that I would hope would benefit all of London. So it's not as if, you know, if you're sitting somewhere in a different part of London, you're not going to see any impact of the VRU, or you're not going to have any relationship to it. Not at all. It's just that element of it won't be where you'll be seeing the money.
Because some of those boroughs are working out quite advanced methods and procedures already. Right, I'll stop there for the moment. So Peter first.
Okay.
Thank you, Steve.
And then Caroline, and then Andrew. Peter?
Yes, morning. I just might have misheard. We were talking about the public health approach.
Yeah.
Did you say you hadn't been to Scotland?
No, I haven't been to Scotland.
I mean, wouldn't it have been quite useful maybe to go up there and...
Yeah, I think I will go up there as well, yeah.
When do you think you'll go?
Fairly soon, but I mean, I've had conversations with, you know, the Scottish representatives that come, that come.
But there's
down
nothing
to
like
the
being
board.
on the ground, you know. There's nothing like being actually on the ground.
No, there isn't, and I fully intend to go. I mean, I know Sophie Linden went, and Cressida Dick went, and I know of other people that have gone, and would tend to go as well. You know, would intend to go, but no, I haven't as yet. No.
Maybe you could make that a priority.
Okay. Yep.
Caroline.
Yeah, I wanted to pick up the leadership role that you've got here, Lib, because it's a really important role. Yeah. And I think it's quite controversial that a party political figure was appointed to this role from the start. What are you doing to overcome those concerns that are out there?
Well, it's interesting that the only concerns that have been voiced are by politicians rather than by community groups. I mean, what I was very pleased about and where I looked for a strong endorsement from was from the community groups that I worked with in Lambeth, all of whom thought, it was a good appointment. I have to say, I don't think that was because they wanted me out the door. but to overcome, I mean, I work cross-party all the time. I've just referred to the local London councils. I've already been to see Nikki Aitken as the leader of Westminster. I have a good relationship with her, just to talk through the agenda. I was also deputy leader of the Labour group at the Local Government Association, which I'm sure you know, again, works cross-party. So I have no problems working with politicians from all parties, and indeed I'm very pleased to be here today because, you know, I genuinely do want people's views from across the Assembly. And I think on my day 2 I wrote out 2 Assembly members inviting them to meet with me, and as a result of that I've met with several of the committee who responded positively. And you know, I suppose fundamentally for me, we are in politics because we want to get things done and we want to make change. And the only way we are going to tackle something as huge and as complex as this is if we really do genuinely, you know, all get behind a common agenda. And so I don't see it as a problem.
Do you understand now that you are an officer, not a politician, and therefore you have to perhaps act differently?
I think that's pretty self-evident, really. Yeah.
Just wondering why then you felt it was appropriate to agree to speak, and then that was withdrawn, but you still attended a public meeting in the middle of a by-election in your old ward, when your chief executive of MOPAC and the monitoring officer had advised you not to.
No, I don't think they did advise me not to. I'll be quite clear on that. I got advice saying I was perfectly entitled to go and speak at a public meeting where I had been invited as the director of the Violence Reduction Unit. The advice was very clear. I realised that concerns had been voiced, and I thought to absolutely speak to the first point that you raised, which was you know, trying to build alliances. I thought I wouldn't speak, but it was a community meeting that had a whole range of speakers where, again, party politics was an irrelevance to it and would have been an irrelevance to my contribution to that public meeting had I spoken.
But you still turned up to a meeting in a ward where there's an election going on,
where I live,
when actually it might be better to step back because you're now an officer, not a politician.
Sorry, I have rights as an individual. I live in that ward. I am perfectly entitled to go along to a meeting in a ward. I heard concerns about me being a speaker, even though I didn't actually agree with them, and even though I've got advice to suggest that I could be a speaker, but withdrew because I didn't want to stay with them. I'm perfectly entitled to go to a meeting in the place that I live on an issue that I'm working on. And I kind of, anyway.
Well, one of the issues for politicians and officers is it's not just whether you do have a conflict, as it were, it's the perception out there, and sometimes it's better to take a step back.
And I heard a concern around perception and therefore didn't speak, but I'm afraid lots of people know me in the local area, and I've worked with lots of people over many periods of time. They know what I am like, and you know, I would want to be at something as important as that in my area.
I just think the shifting from being a politician to an officer, there are different boundaries. But I've made my point.
There have been challenges I would have thought. Susan.
Okay, hi. I'm pleased to hear that you're happy to work with people from all the different parties. I've got a copy here of the partners, and it's very heavy on Labour people. How many Conservatives or Lib Dems or Greens and UKIPs have you got?
Sorry, are you talking about the Partnership Reference Group?
I've got here you've obviously got Sadiq and Joanne, Debbie, Jazz Athwan, who's Labour, Jamie Kurzweil, who used to be or is still a Labour councillor, and yourself. To get a broad approach, where are the Conservatives as an example? Okay,
I think that the Partnership Reference Board is made up of decision makers. Or people who are representing bigger organisations rather than just party political organisations, if I could say that. So my role in being there was to represent London councils, which, as we've said, is a cross-party group. If I hadn't been the lead for crime and public protection, you know, it could easily have been Nikki, who's one of the 10 members of the London Council's executive, or indeed Ravi Govinda, who's the leader of Wandsworth, or the leader of Bexley. That just so happened because it was crime. You'd find a different representative on a different health board.
I do understand that.
Oh, okay. Yeah, and then Jamie is there in the capacity as the lead for housing.
I get that as well.
Oh, okay.
I'm just thinking that it is quite a left wing, if you like, a lineup, and I'm just wondering if you want to be really inclusive, and politicians do represent themselves, an awful lot of people. Why there isn't anybody from any other group here to make it more inclusive?
Okay. Well, I mean, I don't recognise the perception, your perception of it, but I'm not entirely sure personally that would be appropriate in terms of representation, given that if you look at the list of other people that are represented there, which is, it kind of goes back a bit to Caroline's earlier point actually, which is about representative from the probation service, representative from the health service, education. You know, all of those people are representing their organisation, not representing their political party, or London councils, the community representatives that are there, the voice of a young person that is there. I could go on, but I think you kind of get the point.
Could.
So I think what would be more interest, personally, you know, I'm very happy to attend, you know, this meeting or to come to your different party political groupings and talk to you about the VRU, and that would seem to be probably a better place.
You see, you've
place
said
to
something
put it.
very interesting that I don't recognise that perception, and it's
No,
similar to something. Yeah, but in your job, you have absolutely got to recognise perception. One thing that we all learn as politicians, sometimes it's not actually what is the case, it's what's perceived to be the case. And therefore, that is something you absolutely, in my view, should be looking at. If you want to get balance on this, to get answers to broad issues and questions, then you need broad thought processes on main bodies and people that do think from a different angle. And I'm sure it's not just my perception, it's other people's perception. And therefore, perhaps recognising different perceptions is a very important part of your job going forward as an officer.
I agree the importance of perceptions. I'm also, I think, allowed to disagree about what the group is, or what the committee is doing, and who is around the table.
I mean, the point is well made. You need to be working with all of London out there, all the London boroughs, London leaders of different political persuasions, and they need to know that you are receptive to the issues on their boroughs, be it Bromley or be it Brent. Which is such a point well made. Flo, I saw, sorry.
Sorry, just to, obviously I should declare an interest in that. I was the Lambeth Council, so I have worked with Lib. Just picking on some of the comments from my two Assembly colleagues, I think one of the things we found in Lambeth and now I'm finding in Southwark is that the reality is on the ground, a number of people involved in this very difficult situation which we are dealing with want us as politicians and you as an officer now to get on with this. And in looking at how we can actually make sure those voices are being involved in helping to find the solution to this really key issue, can you outline the work that you're going to be doing going forward with those community members who, there's a whole issue around perception and politicians, but the perception on the ground is that the voices of the real people who are suffering from this issue day in, day out, their voices are not being heard, their voices are not coming through in terms of dealing with some of the complex challenges. Their voices are not being listened to in terms of where we should spend that funding. Can you outline how you're going to do that in your role as an officer now?
Yes, thank you, Florence. I certainly can. I have made strenuous attempts in the last 6 weeks to go out and meet as many kind of organisations and as many communities as I possibly can. I'm very happy to read a list, but I don't think you probably want that. But I think it will be useful just to touch on some of the groups that I have met. So a couple of the organisations in Croydon, also Ben Lindsay, who's from Power to Fight in New Cross, some of the more established organisations such as LEAP, which I've spoken at, which I'm sure you're spoken at their AGM, Catch 22, Voyage UK, some slightly more familiar to me like Voyage, Dynamics, and Safer London, just to give you a kind of a sense. Now, that in turn is also not necessarily always getting to the voice of the people who feel most marginalised. So I do absolutely agree with you. There is then a critical challenge that you speak to some of those who are grassroots organisations, some of whom are more established charities, absolutely need to be in the forefront of it, and they're quite often the way you can access more people. But there is something about going out and just meeting people who are concerned or who have been affected, and the intention as of the end of next week is to make sure that a couple of days a week that is something that I am doing. Working also here with the peer outreach team, who I've come to know a little bit, and working with the kind of youth assembly, so that we're getting into the right kind of places. There has been quite a few community meetings already that I've referenced in the papers, the community practitioner group, of which has met 3 times, and a couple more open community meetings. But looking at the best way, I think, to work with, listen to, communicate with people from a broader experience and background as possible, and across all of London, is absolutely at the heart of it, and we're exploring how to do that now.
Thank you, Sharon.
I mean, it will be key, particularly from the delivery point of view,
Totally.
is to get the right delivery partners, and I think the boroughs will be particularly well placed to identify those. Sean?
Just very quickly, I think when we met individually, I asked if you would be publishing your meetings in the same way that the Mayor does. Is that going ahead? Will you be doing that?
Well, I mean, again, mindful I'm not a politician, and I think that's what most of the politicians do rather than the civil servants here.
It is normally done.
I thought that probably wasn't the best way of going forward, but I did think there is something about how the website reflects the work that is being done and is open and transparent. So I take your sort of general point about how do you publicise what's going on and how do we do it, but I'd sort of steer away from that more political way of perhaps addressing the issue.
Great. Thank you for that. We've got some questions now around the emerging work programme, but Sean, you can
Yes. So we now have the papers from the meeting tomorrow. Am I right about the number of days in April? Yeah. This does start to talk about the work programme and things that you'll be doing. Can you outline for us what's emerging within that work programme? I know there's about 10 different points, but if you can sort of talk about that.
Well, I think critically, we're looking at a kind of, the importance of ACEs, which I'm sure everybody's aware of, the adverse childhood experience, and that underpinning a lot of the work, obviously underpinning a lot of the interventions, and thinking about it in terms of the life of a young person. And at what point in their journey through life we can actually meaningfully intervene. And so the work programme is really trying to look at that in a kind of contextual kind of framework. So it's sort of saying it's not, violence isn't one isolated incident, it happens in a particular place and it happens with in a particular context. So the kind of themes or the objectives that have been outlined really start with, how do you make the individual more resilient? What are we doing in the early years to give a young person the best chances in life? Walks through to what kind of family support are we therefore providing? Moving through to, as a young person, an interaction with peers, and that's where I think the voice of the young person and actually young people shaping up that part of the agenda becomes absolutely fundamental. So you'll notice it's light on that in there, but that's very deliberately so. How then institutions engage with young people, and we know that young people are safest at school. So what are we doing to keep schools, making sure that schools are healthy places, are places where which build people's resilience, and at the same time as trying to keep young people in school. What are we doing then when people aren't in school, but they're either in, this is a whole new area or a whole big area rather. What are they doing if they've been excluded from school? But also, what are we doing when they can't be at school, in the holiday period or public places after school, where we know that the 4 to 7 period is particularly dangerous for young people. And then sort of moving through, I suppose, and thinking about relationships with the police, relationships with the community, and also, young person's role in society. So almost as a young person grows old, gets older, I think their interaction with different kind of institutions or their kind of role in society sort of expands, and that's how we're sort of framing up, I suppose, the work programme. So to then get into a bit more detail around that, and I do want to caveat that massively with that we're discussing this tomorrow at the Partnership Reference Group, and I'll be looking to partners around the table to add in ideas. And I also want to caveat it with some of the points that we've just been talking about the community voice being central to it, and that's ongoing work, and the young people's voice, particularly for that period that I just identified being fundamental. So we're looking, for example, at there's various pockets of practice where frontline workers, in particular, well, not in particular, but also police officers are beginning to be trained in trauma-informed approaches. So there's something around that. There's teasing out what is the best practice, but there's definitely a lot of evidence about how important that is. There's importance, I think, around the family and family support that the Mayor's already put some investment into, but let's look at what's going on across London. And Steve, as the Chairman, has already mentioned some of the work that's going on in Croydon. They're doing some really interesting modelling there, but there are other London boroughs that are as well. Moving into sort of education, for example, and thinking not only about the exclusions piece and the off-rolling, but also thinking about the transition around primary to secondary. And I know here that we fund a programme called Stepping Stones, which is trying to get at exactly that that very, very difficult part of a young person's life to navigate. Moving on to the police. You know, you're very aware, and I think you've looked at this committee, some of the evidence there, or not evidence rather, but some of the perceptions of young people and how it's incredibly polarised, dependent on where those young people come from as to their perception of the police, I think, and therefore, you know, what can you realistically do to really have impact on perceptions and the fundamental point about police and young people's relationships. And then moving through, I mentioned society, and I think there is a big piece of work to do around the media, and the media sort of fueling people's fear, but also fueling very negative perceptions, and cutting across all of that. I think there was a huge piece on disproportionality as well. Which you know, I think we've got to be upfront and own, and you know, the way the media reports a black victim of knife crime, that's one example, as opposed to you know, a white person is very, very different and not acceptable in a city that's as diverse as London. So that's a very long kind of answer, but hopefully it gives you a bit of flavour about the kind of things that we're looking to do across that kind of, and how we're structuring, which is essentially across a child's journey.
Okay, that's a colossal amount of sort of things. Yeah. You describe them as pieces, but they're all things that need, they are things that would need doing across quite a wide topic. But one area in which what you've described isn't very wide is that you're mainly talking about youth violence here. Mm-hmm. And in our letter to you and to the Mayor, in fact, no, as you were coming in, we wrote a letter to the Mayor. But it was yes. So it's the letter from us about what we expected of the VRU.
I see what you
so
mean
yeah, I think
it
wasn't to you at the time. Yeah. We asked that it should be focused on all kinds of violence, not only knife crime and youth violence. We particularly asked about domestic abuse, and domestic abuse is a very prevalent form of violence in London, but it's also an adverse childhood experience. So preventing that would also knock on into your youth work. So why is there not more about that in this work plan? And I know you've gone very broad with your introduction there, but you didn't mention it.
Okay, no, that's a fair spot. I mean, I completely agree with you in terms of what I've just said. I mean, I completely agree with you in terms of it's got to be violence in its entirety, and I did say that in my opening comments. And the adverse childhood experiences, I kind of took it for read that we knew that domestic abuse was one of those, or violence in a household. And I completely agree with you, and it's one of the things I feel very passionate about, and one of the things that we actually did a lot of pioneering work in Lambeth around. So the interconnection of the issue and the interconnection around the experience of the young person and how that kind of disables them in terms of going forward, I think, in life is absolutely, you know, spot on. How we really integrate that into the work programme is definitely something I am mindful of, and would be honest and say at the moment we probably haven't quite cracked. You know, the Mayor has given obviously an additional 15 million to commission some of the support services for around domestic abuse, which is to be welcomed, and you know, I would very much hope to be involved in, and will be involved in, you know, looking at how that has impact across all of this agenda.
Are you speaking regularly to the Victims Commissioner about this as well?
Yeah, Claire Waxman. Yeah.
So I've got a tiny question and then a very big question next. Okay. So the tiny question is that in your papers under Changing Perceptions and National Influences, there's a very encouraging line which says that you want to discourage the imagery of knives and other shocking newspaper and social media headlines that spread fear rather than understand the causes of violence. That's something I've been very concerned about for some time. Can I ask, is the Mayor committed to this now, because he hasn't been particularly, and the Met, because the Commissioner has been very resistant to my concerns about the Met publishing quite scary pictures of knives regularly on social media and releasing them to the press, but they often get those images from the police.
I can answer for the Mayor, yes, and I think it's some work that, you know, I'd welcome doing with you, to be honest. I think it's really important, and the more voices we've got behind that as a drive, you know, the more impactful it's going to be. I can't, I'm afraid, speak on behalf of the Commissioner at the moment, but I have met with the Commissioner and do meet now regularly with her as well, and I would very much, you know, I will make sure that that is something that is raised with her.
Yeah,
I think it will come up from the police rep tomorrow. You know,
that would be really useful.
Program, but
if you like, I can give you transcripts of what the Commissioner's been saying to me before, and it's not brilliant. That's just the tiny thing I wanted to mention as an aside. So moving on to adverse childhood experiences in this work programme. Obviously, we've mentioned domestic violence as an adverse childhood experience. Other things like neglect and sexual abuse and family breakdown. All of those things are very sort of early influences on people's lives. They go right through. And when you look at people affected by violence, when you look at people affected by homelessness, you add up the number of adverse childhood experiences, you see this incredible, more or less exponential, you know, the more you have, the more it affects them in later life. So the thing I wanted to ask you about was about what you've been saying about having not enough funding, essentially, to do something that's pan-London and wanting to focus your money. And so the question is really, how preventive is that going to be if you're focusing on areas that have high violence now? The people perpetrating that violence now, in 10 years' time, are going to be much older adults, if they're young adults now. The people that you want to, where you're going to do the best preventive work, are going to be, you know, to keep talking about 10 years' time, they're going to be quite young children now, and you need to be getting involved with them now. So focusing your efforts on where there's high violence may not be as preventive as focusing your efforts on areas where there's high levels of adverse childhood experiences, and the prevention side of things, providing children with ways to be, for example, neglect is a really good example of one where no child should need to be neglected. It's the public services can step in where parents, no matter how bad your family is, the public services can step in. Those are areas where you think that universal London-wide effort would be the most preventive. So how does this square with you talking essentially about piloting projects and seeing how they go when the outcomes are so long-term and the problems are so widespread? Does that make sense?
To partly unpick that very good question, it's also a little bit about...
Don't explain my question.
It's a very good question. But typically it's a very good question. But it's also linked to measurables as well.
Okay. Yes, because we are probably...
I've got a follow-up on that.
Okay.
It's prerogative, Sean. Carry on.
Last meeting.
Okay. So there was quite a lot there in what you said. I don't agree with your general kind of analysis, obviously, on the importance of ACEs. I didn't actually say that it would be... I said actually that in terms of where the funding was going to go, we were developing the criteria for the moment, and the criteria needed to be transparent. And I think one of the things that is important will be incidents, for example, of domestic abuse. And it may be that we might extend to some of the factors that you were also talking to as well. Okay, so I mean that's a kind of live discussion and decision at the moment. So I take on board what you're saying. The second thing is that I was also very clear that while I do think that really fundamental change happens over a longer period of time, and if you're talking about culture change, which I think you need to be in the context of violence, I was also very clear that you do need to be having impact sort of immediately as much as you can, and that the short term is very, very important. So I don't see the notion of just funding something, you know, for argument's sake. Now, this isn't quite what you were saying, but, you know, just funding, you know, a few things for the next, you know, 5 years, and then learning the lessons, and then just applying them elsewhere. So that kind of disconnect between what we're doing immediately and how that is translated and how that's learned from and then applied elsewhere, you know, is going to be a much shorter time frame than I think that question suggested. In terms of the money, it isn't only money that is, I don't think, that is preventing us from taking a more pan-London approach. I think it is something about making sure that we are listening and doing things proportionate to how communities experience them. And that might sound a bit convoluted, but I genuinely think there is some incredibly good practice going on around London, and my sense is to enhance that, and you can only enhance that if you understand what's happening and learn from it, rather than take that very classic kind of, you know, national to local relationship that basically says, well, we kind of know and we all sit up here and then we'll tell you what to do in a local environment. We've got to turn, I think, that on its head, and the power shift is therefore really important. So it's as much about learning and listening and then growing from that sort of understanding as it is about money. But coming on to the money, because I certainly don't want to be obviously putting any barriers around anyone giving us any more money. You know, I do think, you know, we are in a position where we will be able to attract more money into the violence reduction unit. I mean, I've had conversations with London funders, I've had a conversation with the Mayor's Fund. I know that there are corporates who are interested in putting in some additional money. Obviously, the government's announcements, which we're still waiting for detail on, are talking about giving some money towards violence reduction units as well. So, you know, that might make some of it, you know, we've got to be careful about how then we scale it, I think. So it's not only money for me, it's about, you know, the journey of understanding and listening, really, and being able to apply it effectively. And something like the knife crime seed funding, which I'm sure, you know, you're aware of, gave lots of individual pieces of money to lots of really great initiatives, and we're looking with London funders about how we draw out the lessons from that.
Okay, so as I understand it, yeah, you appreciate the tension between working on the cohort that are really young adults now and working to prevent it in the next, because these are different children that we're talking about, and
I do, but I think, I mean, I would temper it by saying I don't think we're talking about a set period of time, and therefore the two things aren't going to be particularly separate for that long, and I still think there needs to be an emphasis on getting it right.
Okay, thank you. Following up on that, in terms of things that you might measure, are you thinking that you might measure the proportion of children experiencing adverse childhood experiences as a potential target? I think that's something that Scotland didn't do. That you know, if you set that as a target, you're looking more at whether you're succeeding at prevention than simply setting crime figures as your target. Is that something you're looking at doing?
It is, but we've not, you know, I'll be perfectly honest, we're not in the position yet of having set out a performance framework. I think it'd be a bit odd if we had, given we haven't established the full work programme, but certainly I think that's a good challenge and something to consider.
Okay, and then finally, you mentioned there's stuff already happening in boroughs. There's already stuff happening through City Hall, there's stuff happening through the police, there's also the whole enforcement side of things that the police are doing. How are you going to sort of incorporate all of that into your work? Because again, this isn't really set out here in the work plan.
Well, I mean, I'm not, sorry. Oh, I thought you were saying something, sorry.
No, it's sign language to...
Oh, apologies, sorry, I thought you were talking to me.
I do this occasionally, don't we?
Okay, fine. Sorry, your question was around the police, wasn't it?
But also, other MOPAC initiatives, Crime Prevention Fund, all of those other things. I
mean, I think they're incredibly important, and we need to align them as much as we possibly can. I mean, you know, the Young Londoners Fund, which is 45 million over 3 years. You know, you've also got, obviously, I've just talked about the knife crime seed funding. You know, you've got the Crime Prevention Fund. You know, so there's a lot. You know, there's quite a lot of resources there that need marshalling, and all. I think, you know, making sure that they're, you know, joining up with some of the initiatives that are being undertaken by the VOU, and I'm confident that will happen.
Are you seeking to take any of these sort of quite disparate funds? Obviously, the Young Londoners Fund is under the Mayor's budget. but the London Crime Prevention Fund is under MOPAC's budget. Are you seeking to take more of those under your wing, as it were?
Well, I wouldn't put it like that. I think what's most important is that, you know, we work together across City Hall to have maximum impact, and if that requires kind of aligning some of the funding, then that's the way you'd go.
You will need to look at aligning funding, particularly across the social inclusion portfolio, that kind of piece. Right, if we can move on now. Caroline.
Yes, part of this work is really crucial that you're working with partners in different sectors. Have you received the necessary buy-in from those for your public health approach?
Yes, I mean, I think what's very heartening is the fact that you've got a partnership reference group that has all those representatives around it, that I think there's been 4 or 5 meetings, and it's always been, you know, every organisation has sent somebody to that, quite senior within their organisation. So I take that as an indication of, you know, an early indication that they're buying into the unit and the approach. I think that's been further added to by the fact that the Mayor was very clear that he didn't want a big team sitting in City Hall rather, and that, you know, it was going to be reliant on secondments from those partner organisations, and certainly, you know, we're already beginning to see those coming forward. So Public Health England have put forward a secondee, as have the Met Police. We're in discussion with probation, we're in discussion with the local authorities, talking to London funders about how best we can get a couple of representatives from community organisations working in the unit. So I take that as, you know, it's a stage on from warm words, you know, people sitting in a room helping to shape something up, and then further, actually, you know, essentially putting their money where their mouth is. And we've had more detailed conversations. So we held a health round table, at which all, you know, lots of different parts of the health sector were represented, and the question was what they could be doing individually to support the work of the Violence Reduction Unit. It was incredibly productive, actually, and I think there'll be lots of initiatives flowing from that. And I intend to do similar series of round tables with some of the other public sector agencies based on that model, because it really was very, very good.
NHS often are very hard to engage because you may get someone locally who's interested, but ultimately they've got different priorities, different setting right up to the Department of Health. How have you found, you know, the hospital trusts and the like in London engaging in this?
Well, I can really only go back to what I just said about the health round table. I have to say, and perhaps being a bit cynical, and perhaps having been in a local authority for a long time, I did wonder whether it would be one of those conversations where everybody said yes, it's a great idea, and then left the room. In fact, it absolutely was not at all. I mean, you know, there were so many initiatives and so much enthusiasm, and lots of different parts of the health sector really coming forward and being prepared to step up, which I'm very happy to share with you if you want a more detailed picture. But yeah, no, it's very positive.
So one of the ways the NHS can engage, and the local hospital trusts in London can engage, is to fully work with you on the Cardiff model, which is something I've been pushing for the last decade in London. We've still got 2 hospital trusts that haven't fully engaged in it. St George's had dropped out. I think they're now coming back to the table. Chelsea and Westminster had never been at the table, but I think they might be now. How are you guaranteeing that all of those trusts are at the table, signed up to this? Because sharing anonymised violent data that comes through A&E helps you map those crimes, and it's part of when you look at what Scotland had done, is they used data from hospitals, fire service, social services to build up that picture of violent crime.
Yeah, I think it's really important, and you were urging me to go to Glasgow. I think a visit to Cardiff would also be really good, because I think the work that they've done there is very interesting, and particularly obviously on this issue. St George's was actually raised at the Health Round Table, and action was taken as a result of it, and I think that's been quite helpful in pushing it along and coming back in. Chelsea and Westminster I didn't know, but I will take up.
No, because
I completely agree with you.
I've been pushing this vote to the Mayor earlier in the year and had a reply that sounded like we were almost there, but we've been there so many times. So
if you could, I can find the correspondence anyway. I'll make sure I pick it up. But I agree with you.
Thank you. And then I think it's just the description in the paperwork was that this work with partners is sideways work. What does that actually mean in practical terms?
It's very interesting, isn't it? Sideways work. It's not actually a description I particularly recognise.
It was in the paperwork. I think that's
I have to say, that was one of those terrible pieces of language then that got through, wasn't it? Yeah.
So it's a sideways work with partners in different sectors. It doesn't.
I don't think there's any significance.
No. Okay.
I think it's whoever invented the egg timer bow tie thing, kind of trying to justify it. Who knows?
Okay, but that was
well, I will look for that and edit that out, because those kind of pieces of
I
language.
thought this was some new thing that I didn't know about sideways work.
I think it's one of those.
Okay. Now, London is obviously complex. There's lots of people who come into London think they can come up with something straight away, and they suddenly realise you've got 32 boroughs, the city, different public sector arrangements. It's complex. At a sort of structural level, do you think London is set up to be able to deliver this public health approach? What are the sort of barriers you're finding that you've got to overcome to deliver it?
Well, I have to say, 6 weeks in, I've been incredibly impressed by how everybody signed up and the enthusiasm of people across the piece, both public sector partners in City Hall and out in the community. So I wouldn't as yet describe them as barriers, if I'm honest, but I'm obviously not naive enough not to realise that I am going to confront barriers. And I think it is what you've just touched on, it is the complexity. You look at somewhere like Glasgow and they adopted an approach, and they could kind of essentially, from the centre, sort of push it through. And then they thought, well, actually, we should work a bit more with some of the communities, and they were in a position to be able to do that. So I'm not under any illusion that the kind of levels of complexity, both within the organisations and across the organisations that we need to work with, is important. But, I also think that there is a real... and this isn't a kind of platitude, I also think there's a real pride in being a Londoner, and that people have expectations of what it means to live in London. And I think the kind of London is open campaign, I also think the notion that London is inclusive and that it's fair, and that there is an identity across London, as well as multiple identities within neighbourhoods as how people identify themselves, mean that we've absolutely got to work at something in a different way. And I don't think, once you establish the importance of a cause, and once you establish the reason as to the means by which you're going to tackle it, I'm a genuinely believer that, you then, if you've got that and you can instill that kind of common belief in people, then the kind of systems and structures should align themselves to that. Now, there are a hell of a lot of barriers in the way, but I think you've got to go in on that premise with that kind of passion and that kind of optimism, or frankly, we'll all give up and go home, mightn't we?
Okay, thank you. Then we've talked about complexities at the regional level, but clearly part of your work is within the national context. And I think at one of the earlier Violence Reduction Unit partnership reference groups, it said that this has got a role in driving, influencing change and pressing for national system structures to respond to that and what's needed. So, influencing that national agenda, how do you plan to go about that aspect of the role?
Well, I had a very useful meeting yesterday with Nick Hurd, and I think the government have been very keen to see what's going on in London, and we're talking the language of collaboration. We've already mentioned the fact that they've put some money to one side, although we've got no detail of it at all, around the 35 million in the most recent announcement. I think there's an enthusiasm at government level to find out what the blockages are, and I'll be certainly exploiting that in the best way I can to, for some of the combined barriers that we learn about from the partnership reference group, or the things that we hear from community, to really sort of marshal evidence and look for a change in policy. And I think one of the things I touched on earlier on is clearly around the kind of educational challenge, the lack of information, for example, around off-rolling, which I think the Mayor has done a good job to highlight through the Ofsted review, and that's certainly on the government's agenda, although we've got no sign of the Timpson review, of course, which would be quite fundamental to some of this. So I think that's one way in which we could, make sure we're influencing policy. A second is, we touched earlier on, the media. So it's not only always policy changes to government, sometimes it's looking at practice changes from sort of key institutions. And again, I think, the Mayor is a representative of the whole of London. He's think he's got the biggest electoral mandate for somewhere, hasn't he? Yes, a lot of votes. Thank you. So, you know, I think you've got to kind of use that from what you hear from London organisations and from what you hear from London communities, and you know, as long as you've got a compelling case, you need to be making that to the relevant policymaker, which in most cases will be government, but not exclusively.
So it's interesting. So I was going to go on to school exclusion. So that's something you've already discussed with government, with your meeting with the Minister?
No. I put that on the agenda.
Right.
But we did discuss at the Partnership Reference Group the last time it met, and we had a presentation from Joanne McCartney using some of the stats from City Hall, but also a presentation from the guy leading the Ofsted review.
Okay.
And it was a useful discussion.
And how will you be using the VIU, and how will it be involved in having to make the case to government in this area?
Well, I started by saying evidence and data is critical. And one of the things that we are doing as one of our first pieces of work is a serious and homicide review of all the cases that there have been over the last year. I'm working with London boroughs, and I think that will provide us with a really good basis of evidence, I hope, and obviously extracting from that, therefore, what needs to change, and using that to make the case to government will be fundamental.
This serious case review, which I welcome, is that similar to what Croydon Safeguarding have done, which I think is a superb piece of work. The evidence is unbelievable from that. It's so powerful.
It really is, isn't it? I mean, you look at the 19 kids that were vulnerable, and they were all excluded. 19 of the 60 all excluded from primary school, weren't they?
Yeah.
No, went on to be. So yes, I mean, we will need to make sure that we're not, that we're working with other, London boroughs as well, because there's similar pieces of work, although the Croydon is the one that sticks out most in my mind as well, but there are similar pieces of work I think Islington have done, for example, and way back Lambeth have done as well. So it's making sure that we're drawing on that, but yes, it should give us that evidence base.
And then what about the Home Office in all of this? How are you planning to work with the Home Office? They're going to be looking to you to see what you might deliver as best practice for the country, but also what do you want from them?
Yeah, I haven't as yet personally had any connection with the... no, that's not true actually. I have met one of the lead civil servants in the Home Office. I mean, I think the more we can share information, the more we can work with them. It will contribute to our success, really, and hopefully theirs.
Okay, thank you.
I'll bring in Flo and Pete, and then Susan's got a question. One point I'd like to support with Caroline's questioning is about the delivery at pace, and comparing us again to when we went to West Midlands. Basically, David, the PCC, could press a button with the commissioner, the chief constable, I should say, and then tell about 3 or 4 district councils to get on with it. And it worked at pace, and we do not compare with that. It's just because of the size of it. Anyway, sorry, Flo.
Yeah, just on Assemblymember Pigeon's last point, really, the Home Office. Again, we know that government have been having a series of meetings, both at Downing Street and at the Home Office, and I think the scale of this challenge is actually quite big. And somebody we both know well, Pastor Lorraine Douglas, tweeted, and I think in a sense, going back to the frustration that I expressed that a number of people on the ground are feeling about this whole agenda, she tweeted her frustration about that meeting, to say it was really good to have the access to the Prime Minister and top cabinet members, but that they were all segregated into different rooms and they didn't really listen. And it's something that I mentioned with Assemblymember Hall just before we came into this meeting, and that the whole paralysis of Brexit is stopping, our cabinet ministers getting on with the real key domestic issues. How hard do you think that's going to be to actually get through to the Home Office to deal with this massive agenda?
You referred to the fact that we both know Lorraine very well, and she's not somebody, although she's very, very passionate about what she does, she's not usually somebody who's outspoken actually in the way that she was, so I did take that as a real serious measure of how she felt kind of let down. I think subsequent to that she's been invited back in, hasn't she, for another meeting, but it does illustrate the importance of having actions. And, I think it illustrates the importance of not just talking, but delivering, and it also illustrates the importance of actually really being able to find space to listen critically to the community voice, and it seemed from her interpretation of what happened in that instance that hadn't taken place. I haven't yet seen any of the notes from the Serious Violence Summit. I know that Sadiq obviously was at it, as was Sophie, parts of the sort of roundtables that followed. but we'll be keeping a close eye on it, and as I said before, really working appropriately with them where possible.
Peter.
Thank you. What are your media relations like, as it were?
And my media relations?
Yes. Sort of in the sense of building a profile, you've got an extremely important position. And what I'm thinking is, if you're trying to break through to things, it's just great for people to know who you are and know you're there. I mean, have you done any big interviews or anything yet?
No, I've done two. No, only one since I've been in the post actually, which was I think on the second day we went to visit a really excellent kind of initiative in Croydon actually, which is the BME network, which was facilitating one of the sports. Sorry.
Hang on, having Croydon every example.
It's my second reference, isn't it?
We need to go. Outstanding, actually.
Anyway, it was excellent, and so I was interviewed then, but no, I haven't done any other set pieces since then.
Maybe to try and up us a bit. I mean, it's just a.
Well, I take advice on that. I mean, I think you're right in the sense of you want to use any opportunity to influence the agenda, but equally, it's really important that we're promoting the work of the unit.
Yeah, of course, that goes without saying.
That's the challenge, when you're conflating the politician with the officer.
Absolutely, that's another challenge as well.
That could blend into that. Right, that's great. Susan, I'm sorry. It's all you.
Okay, I can ask the next question, yes?
You may, yes.
Thank you.
Please do.
Well, yes, thanks. What types of roles will you have within your central VRU team?
Okay. Thanks. So we're out for recruitment at the moment for the central team. I've already referred obviously to the secondees that are coming in from the public sector agencies. At the moment we're going to have a senior commissioning manager, so somebody essentially to take care of the money and to do the due process of getting that money out of the door. A programme manager who will keep the work programme on track. And then we've got a couple of community engagement officers who I was trying to recruit yesterday. And that's obviously very important to facilitate really working closely with different community groups, but also making sure that we're out of City Hall and working with people. So a fairly small team that we're recruiting.
So basically 4 people and yourself?
No, the central team will be a bit bigger than that, because obviously you've got to add in myself, I've got a PA support, and there is a head of the unit as well. So I think you're more looking at probably about 7 as a central team.
And it'll stay at that, will it?
I think so, yeah. I mean, we're keen to kind of, it's new, obviously, we're just setting up. It may be that we're setting up the team. Obviously, a lot of thinking's been done prior to that, but so it may be that we need to. We find out within a year that we need a little bit more of data analysis rather than program management. But we'll have to. We'll change that as we go along. But in essence, yes, we're looking at about a team of 7. Okay,
and when do you hope that that team will be up and running?
Well, I am very much in interview week, I'm hoping that we'll have made decisions by the end of next week on those posts, and therefore it'll very much depend on what other people's employment obligations are. But I would very much hope. Therefore, what are we in April? So be looking at beginning of July, wouldn't you?
Okay, and that's being done, and these. Because obviously there was so much controversy about the fact that you'd written your own job spec and then got the job. So these people, their job specs, are they coming through City Hall? What exactly? How transparent are they?
Oh, I think they're on the website, obviously, because you need to sort of promote to be able to recruit. So yeah.
I know, but we wouldn't want the same controversy over.
I'm sorry, do you want to ask me a question about my recruitment, really, or do you want to ask me a question about the team?
No, I think everybody's had comments about that.
Oh, fine,
and obviously you want to steer clear of that for the people in the unit. So that's being done completely separately, and we'll be able to look at that, will we?
Yeah, I mean, it'll be advertised in exactly the same way. It'll be on the website, as indeed my job was, and people will be able to comment be able to apply and... I mean, the usual kind of way in which you recruit people, really, in an organisation like City Hall.
Okay, thank you.
Okay, great. We turn now to... sorry, I didn't see you, sorry.
Thank you, Chair. Very brief. We haven't really talked much about the police so far, so can I ask you, the Met currently has a violent crime task force. which some of us have been on patrol with, and some quite impressive work being done out there on the streets. So how are you liaising with the Met to ensure that the activities of groups like the task force and your unit are aligned? And more generally, what's been the attitude of the Met so far to your unit, which is still in its infancy, but just give us a feel of the Met's thinking?
Okay. Well, I went along to a Met strategy meeting and for my first few weeks, which was the sort of top tier of the Met. So that was, a good early invitation. I think it's perhaps indicative that they, are really keen to work alongside and with the VRU. They've got a representative on the partnership. I then subsequently also took part in another kind of small kind of strategy away day thing. I meet with Steve House and Cressida Dick, which they meet with Sadiq every week, I think. And I normally go in for a first item where it's appropriate, just on violence. So I've got that mechanism. I think I referred earlier to having met on one-to-one with Cressida and a couple of the other senior police officers. So relations in that sense are very positive. We've talked through those meetings about exactly how they can work as one of the public sector partners in shaping up the programme. They've been involved in the partnership reference group and they've also provided a secondee to the unit, one of the first organisations to do so. I think there's a lot of optimism actually for how we're going to work together, and it's absolutely critical. And you also reference the work of the task force, which I agree has got some impressive statistics behind it in terms of finding knives and really doing some effective work.
One more question, Chair. This morning we were given details of the work programme. And I note that in the objective, changing the message around violence, there's talk of developing a movement against violence that draws in ambassadors to promote positive messages. Yeah. I think that when we met, I wasn't only meeting so far, but hopefully there'll be more. I did talk about the need to involve the families, friends, families, relatives of people who either have lost their lives or have been attacked. So presumably thinking of involving families of victims of all types of crime, but giving them a prominent role, because goes on saying that they are some of the most powerful and eloquent advocates of any anti-knife crime strategy or any anti-violence strategy.
I completely agree with you in terms of, I would hope it would be more than just around the messaging. We referred earlier to Lorraine Jones as being an example, and you've got lots of, I think, incredibly powerful men and women whose, unfortunately, children, have been murdered, and they've gone on to do some fantastic, grassroots work at the Business Summit last week that have been convened. We heard from the Merzen family, and so there's loads of stuff that I think people have been doing, and that you want to engage with the families of victims, both in the messaging, and in the work programme.
So I must get this in, Chair. It's important that these ambassadors are given meaningful role, because I'll tell you why, Lib. Yeah. About 18 months ago, 2 years ago, we were told that the mayor said that he was going to have modern slavery ambassadors in each borough. So far, we haven't seen any sign of these ambassadors in action. So then it transpires that these actual ambassadors, who also would be some civic figures or local well-established community figures, is actually a police officer. And what he or she is doing in any of the boroughs, I know not, certainly not in East London. So I think the salutary lesson of that particular experience is modern slavery ambassadors are non-existent.
Okay, thank you. Well, I wasn't aware of that, but I'll take that point up. Umesh. Yeah, thank you.
Okay, turning to, if we made to local delivery, now we've touched upon this, and Navin and I have got some questions around this, because our briefing up to 48 hours ago was talking about local hubs. They've kind of been shot down in flames, but what is interesting more practically is how you're going to deliver, because going back to this blessed thing, you've got local delivery, local violence reduction units, which I believe, to speak for myself, we're going to deliver. This building isn't going to deliver. This building is going to be facilitator, part funder, and out there, arguably, other people and groups will deliver, logically. And the model that we understood up to a couple of days ago was the local hubs were going to deliver. Okay, I had several meetings with Jonathan Toy, who you all know, down in Croydon, designing Croydon one. We keep talking about Croydon. Let's talk about somebody else, Lambeth or Lewisham. They're doing that sort of Southwark and all that sort of stuff. So, but the model was predicated on this pan-London hub delivery. That's not happening now. So I'm still interested on how you're going to deliver, but those local authorities aren't going to stop forming their own violence reduction units. They've invested a lot of money in them already, a lot of officer time. How are you going to work with those local borough VRUs if you're not adopting a hub model? Please help me on this one. How's it going to work?
Okay. I mean, just to go back to what I sort of said earlier on, the rationale from changing from something like that was that it felt too imposing a structure to me, and it felt too, it just felt spreading what we had too thinly across London. Okay, so that's the kind of principle, and that was informed by lots of conversations I had with a variety of people, from community to community practitioners groups, and also to when I presented at the Chief Exec's meeting. So that's the kind of theory behind it. I think if local authorities have set up violence reduction units, and that it really demonstrates, which I think it does in the instances of where I've heard that's happened, does really demonstrate an engagement from all the relevant parties in the local area, all the relevant organisations, alongside and critically, the buy-in of the local community to enhance the credibility of that unit, then it seems to me that becomes an obvious point to have a conversation from City Hall with the VRU. Completely. I mean, in a sense, that becomes the local commissioner, doesn't it? Yeah. In other places where they haven't set that up, but they've got a kind of different structure, I would want to apply the same tests, i.e., is it genuinely working with people? Is it a genuine example of partnership working in the local area? Is it credible to people who live there? And if that becomes, if it's not called a VRU, but it is called some local partnership or some variant of it, then that becomes a really useful body. So I think for me, my kind of reticence, which was further enhanced by, the kind of conversations I had, was just this notion that you had to kind of template out, VRUs, and every borough had to have its VRU, and it had to work on what structures it already had, and reconfigure them into something that enabled City Hall to be able to sort of look out and say, oh, there's a VRU, so we can fund that. I know good practice that's happening around London. There are many boroughs that are really looking at how they change the way they approach this issue, and that will then be the appropriate forum.
I understand the premise of having targeted, so we've got a noise issue, but it's now been sorted, of having targeted pilots. So I think the premise that I'm understanding from you is a model based on targeted areas, targeted pilots that hopefully will be successful. Then you can evidence-base that to get more funding. So potentially, I kind of get that. But you talk about, you're going to have, in this organisation, a limited amount of money, but out in the boroughs, on the communities, they're listening, they're hearing that there's more money coming out of City Hall to commission this work.
There is quite a bit of money coming from City Hall when you add the totality of the things that we talked about earlier on.
But the point I was trying to make before you interceded was that if the local boroughs will know the right communities and groups to deliver. I think that's important. That's how I found. I'm going to bring Navin. That's how I was attracted to the hub model, because the hub would only be one borough doing the work for 4 or 5, but they would be on the ground identifying the community groups best suited to deliver the monies that you've got in your back pocket. So that's still something we need to investigate over the coming months. Sorry, Navin, you want to come in?
Thank you, Chair. Lib, I'm still seeking clarity, if I may, therefore, kind of go back to the basics. Earlier you said that on local hubs, you're thinking your work is still evolving, that it's not set in stone. Now, I appreciate that you are looking at what's going on with London Council, some of the boroughs that we talked about, including Croydon. Any idea when you're likely to kind of crystallize your thinking, your strategy, whether you are going on local hubs model or you're going to just look at priority areas and roll it out in that sense, because I think it's about 7 or 8 months since VRU was kind of announced, and time is getting on, and we really need to have a clear thinking, clear strategy, so that both VRU and local authorities can get on with it, and we actually have an impact on the violence which is on the rise.
Yeah, completely agree with you about the urgency, and obviously tomorrow has been mentioned a few times. It's the partnership reference group, which will get a clearer understanding of what the different partners think. Once I hope we get the kind of green light for moving ahead, then we've got to establish the criteria and obviously start talking to the boroughs that therefore, fit that criteria. So I would very much hope that we're in a position at the beginning of June where we could start talking much more specifically about what that looks like. And then we've got a challenge because, as has been mentioned several times, we've got to get the money out the door. Yeah.
Do you know how many other boroughs than Croydon have actually got something similar or a form of VRU?
Not off the top of my head. I mean, I know anecdotally, some places where they're setting up VRUs. I know some places where they're not necessarily calling them VRUs, but actually they're more or less the same thing. So, no, I don't.
If you can let us know, please, if you...
I can do once I find out.
When you get that information. And,
that's fine.
Yeah.
I mean, it is my... Sorry, I should just say, I mean, it is my understanding, and this is more in my previous role rather than actually in this current role, that lots of local authorities have looked at how they can restructure their services to make sure that this is being dealt with kind of corporately, and it's taken on, and that it's a priority. So, I know that's been the case in Lambeth. I know that's the case in Southwark. Obviously, we've referred to Croydon, Waltham Forest. Camden's doing some interesting work with young people. Islington has quite an effective gangs unit. I know that similarly, Westminster has done a lot of work in this area. So, I mean, there's lots of good practice out there. I think, which is partly why I want to kind of go with that grain rather than imposing a kind of VRU template on these places.
Currency of trust is vital to gaining access and confidence of local communities.
Yeah.
This committee's investigation into serious violence found that trust between the police and communities is especially important in tackling violent crime. How will you ensure that VRU has that trust of the local community and the local residents and stakeholders when they're involved both in policy as well as how you implement it?
Okay, 2 points there. I referred to it earlier on about the trust issue, particularly from certain communities between young people and the police. I think that is something that we've got to own as a problem and try and do something about. I know there are various initiatives across London, but I really think that we can't really talk about intelligence-led policing if the kind of people we're relying on for the intelligence feel very, very remote from the police force that's serving them. So, I think that's a very genuine issue. In terms of how I would engender trust with communities, in terms of the work of the Violence Reduction Unit, I mean, it always comes back to what sounds like very basics, but I think it is very basics. It's listening, it's doing, it's delivering, and it's making impact. And really, I don't think you can expect people's trust unless you can walk them along that journey and walk with them critically. So that's what I would be hoping to do. That would be the ethos, or that is the ethos of the team, and that's what we've got to. That is our challenge, I think, quite importantly, and that's why it's incredibly important to get out and talk to as many people rather than inviting them into City Hall. Go and see the work that's going on across London, and I've done some of that, but I intend to do a lot more of that.
On your VRU steering group, there is community representation there.
Yes.
How many, and how do you actually appoint them?
Right. Okay. So there was I think there were 3 community representatives on the group, and also a member of the peer outreach team. There was a commitment made probably about 2 months ago to expand that to 30% of the group, the community voice around the partnership reference group. And I think you'll probably see from the papers that are going there tomorrow, I'm proposing that we actually do that, and we do have 30% of the representation is of community voice. How you put the community voice. I genuinely don't know how the process of the 3 people that are on the committee at the moment were chosen, because that predated my time as the director of the Violence Reduction Unit. But I would say that they are in many ways the most effective members of the committee, because they really do provide challenge, and I think that's really important.
If you don't, you see, my concern is that if there is not a particular emphasis through something like local hubs, which will actually have more local, or potentially have more local intelligence, more local kind of involvement, how would you ensure that you actually have the right level of community representative? And again, what are you doing about, for example, representation of the youth on the steering group as well? So the question is, if you move away from the local hub sort of option, how would you make sure that communities are duly represented and that the right numbers and the right locations, etc.?
Okay, I mean, I wouldn't want to get hooked up on the only way that you can deliver representation is through a local VRU model. I mean, I think I've tried to say several times that actually the principles around local delivery will be the same. It's just maybe the adherence to the structure that is the thing that I'm challenging. But in any case, in both instances, I think you're right that the challenge is how do you make sure that there is enough community voice in all of these structures, and how do you make sure it is authentic and therefore representative of the communities that it's serving? And that is a huge topic, but part of that has to be, I think, going out and finding out what is being delivered on the ground, and making sure that the structures that you're putting in place, and the partnership reference group won't be the only structure, though we are focusing on it at the moment because it's been the most obvious, that you are genuinely reflecting that. And, you know, as I said, I think that making sure there is at least a 30% representation around the table is one way of at least starting that, making sure that there are means by which you can really capture young people's voice. And I think I talked earlier on about the part of the work programme that we've identified as an objective but we haven't really fleshed out, is because I really want the young people to take ownership of that and develop that. And making sure that on the group that we've got at the moment, you've got somebody from the peer outreach team, and it's also looking at the team that we're recruiting for at the moment and making sure that there is it's reflective of London's diversity, and age is one of those criteria as well.
I'm concerned that if we are not careful, we could have a situation where some of the boroughs may feel that they are left out or not being part of the whole process. Because I can give you a classic example of the constituency I represent. Brent, which has got quite a number of, much bigger issue about violent crime. When you look at this recent statistics as well as the history, whilst Harrow hasn't got that, but you got bordering neighborhoods, okay? And certainly, I don't see why people living in outer London boroughs or areas which are historically seen to be sort of not having a higher level of violent crime, but there's equal amount or greater amount sometimes of perception of crime, and they're equally concerned about even one incident that happens there. And that is where I would want to make sure that we actually cover all of London, whereby that sort of concerns about violence, whether it is perception, real, and today you may have less, but anything can happen in future. And therefore important that those boroughs also are reassured and feel comfortable that enough is doing to make sure safety of people in those areas as well.
Yeah. No, I mean, I agree with you. The message and some of the central work has got to be across London. I mean, no way, you know, you can't be in any way complacent, can you, in any part of London, I don't think. I mean, it's more, you know, what we were talking about was just the honing in on certain places to extract the better practice. Steve, sorry, can I just say it's 11:30 and I was down for an hour.
I wasn't informed that there was a time limit on this.
Okay, I was.
Well, I wasn't. So there's a breakdown there, and we've got one more set of questions. But
okay, that's fine.
I wasn't. Your office.
2.5 hours.
I've got something at 12.
Let's just say these meetings are set for 2 hours, certainly, and your office, it didn't filter its way through to the chair.
Well, I'm not immediately.
You might want to send a text. You might want to send a text or something to somebody. Right. So let's pick up a pace, Navin. Anyway, just to be helpful.
Yeah. One last question, and that's regarding funding. There's allocation of 5 million this year. How will that work in terms of allocations to boroughs, or how, I mean, when will we know the whole program and what the strategies and criteria are for funding for utilising this 5 million?
So the budget this year is 6.8 million, and there is an expectation, a mayoral expectation, that 5 million of that is spent on the local delivery. And as I've just, I think, outlined, I would be hopeful that we're in a position at least to know criteria and have had some of those conversations about delivery mechanisms sort of soon at the beginning of June, and then obviously the challenge is how you then spend the money and get the money out, which is part, I suppose, of another challenge. In terms of the 1.8 held more centrally, that will be to enable work to go to happen also across London. So there is that, to address your earlier concern. There is a sense that all of London would be benefiting, not just a few places.
And how will you measure both the success and make sure that those boroughs
or to see there, because that set of questions that Andrew's leading on.
Okay.
If we may.
There was a bit in here about the accountabilities.
Navin, fantastic. I'm going to ask Andrew to a question, and then that Andrew, and then we'll finish on that.
Computer funding and stuff.
You quite assertively indicated that you want to, rather than have a set model of local hubs, you want boroughs themselves to come up with their own solutions, because you said there were sort of delivery systems already in place. Can you name some of those? Can you name some of those delivery systems that are already in place that will be able to deliver?
Well, I think I referred to some just in general.
You did some things in general which hit part of the public health approach.
Yeah.
You didn't seem to indicate anything that would bring together many agencies in one place to be able to deliver the system.
Well, I mean, I can't give you the complete answer that you want, so I'm not going to pretend to. What I will go back to just sort of mention again is that there will obviously be a criteria. So, it's open and transparent. It's not just phoning up a few boroughs and saying, look, we've got 5 million, how do you want to distribute it? Quite clearly, there needs to be an open, transparent criteria that we're working on that would include things like domestic abuse, and I think Sean was giving me the challenge of whether we could include ACEs as a criteria, but that's being worked on. After that, you then obviously then start to look at, the delivery capacity in some of those boroughs which are then, able to have fulfilled the criteria. And what I was saying in sort of parallel to that was that there are some places that I know where they are beginning to pull agencies together in kind of a VRU way, that they're adopting a public health approach, and that are working very closely with the community. Now, I don't know that exhaustively across London, and I would absolutely need to and want to.
Right, to us with some examples.
Yeah,
of that.
no, absolutely.
I'm wondering that, from my perspective, I'm wondering why it is we're trying to reinvent things like multi-agency safeguarding hubs, where already you have a successful delivery, multi-agency delivery. You've already got people sitting in the same room. And I just wondered why you would do another one and another one for multi-agency working, when actually the model's already there.
Yeah. Well, that's in a sense, I think, I don't want to put words in your mouth, but I think you're agreeing with my earlier premise that we don't want to suddenly find a new structure and put it into a place. We kind of need to work with what is in existence, which is why I was a little bit...
But would you also have in mind, therefore, if we have a very variable ways of delivering on the public health approach, that we are able to measure the KPIs, because there's a lot of statistics in the
measurables over here. Next
that
question. Measurables. Next question. Andrew, get to the point. I think you're inevitably going to get to.
No. I'm going to leave it for there because Andrew's going to raise that.
Yeah. Do you have anything else?
No, that's it. Fine. Thank you very much.
Okay. Right.
But I will pick up your point, Andrew.
When you say right, I'm going to bring this on.
I'm sorry.
The point that was raised about certain structures working. Well, in many places, they've not been working. So it is worth reinventing. Now, last set of questions. Andrew.
Okay, measuring success. It's sort of been flagged up
several times.
I'd like to just actually focus on that. So the first and obvious question is, how are you going to measure short, medium, long-term success and for the unit? What are your objectives like that?
Well, I mean, if we trace back to the objectives that I referred to, we're trying to stabilise and reduce violence, so that's a pretty clear indicator. We're trying to interrogate the causes of violence and therefore have effective interventions, and that could lead you to measuring things like ACEs in a particular place, possibly, and that you're also looking at people's perception of how safe that they feel and how inclusive that they feel London is, and both of those are things that you would measure through, polling, I would imagine. So, you've got a variety of different ways to test out those kind of three strands, but we haven't as yet, as I said earlier on, landed exactly the way in which we would do that, or indeed develop the KPIs. All I am certain of is that we absolutely need KPIs, and it needs to align with the work programme, which we're hopefully going to be, agreeing fairly soon. So, I mean, it becomes a bit chicken and egg, and I apologise for that, but I can't...
Well, that's the next question.
Okay.
In the sense of objectivity is what we're looking for, I think, objective criteria, and as Andrew says, and I think you've just accepted, KPIs with objective numbers in it are important. And if, are we saying, okay, what we're looking at are clear objective figures for reduction of death through violence, reduction of domestic violence, reduction of injury through violence, lifetime and so on. I'll be looking at key, first of all, benchmarking, I suppose, and then seeing how those numbers progressively go down. The reason I raise that is that in Scotland, the first 5 years it was working very well, and it seems to have plateaued since then, with the number of homicides staying more or less the same, and violence ticking up slightly. I think somebody called it going for the low-hanging fruit first. Well, how do you make sure that, if we say that's the medium term, in long term that trend continues? So how are we going to measure it in an objective way rather than saying, oh, subjectively this is all very good and wonderful?
I think it's a real challenge, and one that I'm not going to be able to provide an answer for now, I'll be completely honest with you, but very happy to discuss at a later date when we've done more thinking around it. I think what we've touched on today is the complexity of the causes, the complexity of the challenge in the institutions, and I don't therefore think there's going to be a very straightforward way in which we can measure it, but I accept the principle, of course, that we need to find some way in which we can measure it, and that needs to be something that people can understand and relate to, and that is transparent, and that gives us an indication of what progress is being made, and therefore needs to be sort of flexible and sensible enough to adhere to a short time frame and a bit longer. But I'm genuinely sorry, but I'm not going to pretend that we've worked all that out, because we haven't.
Okay, well, I understand that, but inevitably, if you don't have KPIs set from City Hall, where you are sitting in the Mopac, the outside world will start to impose their own KPIs, and you can be sure that the media, for example, will be keeping a very close eye on the number of offences, and will be measuring against that. So when do you think you will be in a position to set KPIs publicly for you to be measured against?
Can I, just before we do that, one thing that I always think is quite interesting in some of the projects that I worked on in my previous role, is that you talked about Mopac and City Hall determining the KPIs, and I think there's sometimes a real we missed a trick there, because I think it would be really interesting to get some of the community to help us develop what they think are the right KPIs, and that's something I would be interested in exploring, and particularly maybe in relation to some of the local delivery, because if one of the key objectives here is for people to feel safe, which it is, to feel safer, and it is for young people to feel more at the heart of shaping their society, really, in a positive and constructive way, then I would be interested in conversations with them about what they see as the measurable, what is the kind of real test for them of how we've succeeded or not. So I do think it's quite a complex piece of work, but I'm sitting in front of a scrutiny committee. I realise that the work is going to be scrutinised, and not only in these circles, it's going to be scrutinised from the media. So there is going to have to be something that you can track the impact of the work.
Well, certainly I accept all you've said about looking at local delivery, but in the end, we do have to have something that's objective. I mean, subjectively, do people feel safe? It's difficult to measure. If you do it by polling of some sort, then it comes down to what's the question and so forth. But key objective numbers, I think, are really important.
Okay. Well, I've heard what you said, and certainly when we're having that discussion, be mindful of it.
Yeah. So then, what evaluation mechanisms are you going to build in?
Yeah, I mean, very important, and again, something that's a bit further down the line, I think, I'm afraid, because as I've sort of said, we're obviously developing a programme now, and how that translates into, then we're going to have to look at how we would evaluate that as part of the criteria, and the KPIs that would flow from it. So.
And the last point, this is following up from something you just said, I think, and what Peter was asking about earlier on. How are you going to communicate with Londoners and stakeholders such as ourselves what you're doing and the impact you're having?
I think that's a really important challenge, and I think we've got to think a little bit outside the box, because I think that if we again look at the constituency that we're most keen on working with, it's young people, and young people do not communicate in the same ways that we might assume. So, the newsletter through the door is not going to do the job, is it? A social media campaign designed by young people may well do more of a job. So I think that we've got to once we're up and running in terms of a work programme, we absolutely want to be communicating, and there's a challenge to communicate with the different stakeholders. I think breaking it down, there's a piece of communication that's needed with inside City Hall, a regular update, probably every week. There is a challenge around working and communicating with all the stakeholders. I would say that I think the stakeholders have the same responsibility on them as well. If we're looking at prioritising violence throughout all of their work streams, then we want them contributing, not just being recipients of that information. That's a key part of it. And then thirdly, how we do more of the public stuff will be a variety of messages. And I think City Hall has done some quite interesting things around social media, particularly around the knife crime campaign, and I would want to be looking at the lessons learned from that and seeing how we can then communicate most effectively.
So, if we look at your team of 7, is somebody going to be specifically tasked with communicating?
No, we will also draw on some of the resources that there are across the organisation. I think that's important. That this is a partnership role. We're not accepting. The whole principle of the way we're trying to work differently is not assuming that the unit itself has to do everything. So it's looking out and making sure that everybody sees it as on their agenda, and therefore everyone's contributing to it, which is, I suppose, part of the rationale behind the secondees coming in from different organisations, and certainly would be part of my rationale thinking across the piece of the resources that they've got in City Hall, given it's a mayoral priority, and the importance of this to Londoners. We need to marshal what resources there are internally to make sure that we're giving ourselves the best chance of communicating effectively.
Susan.
I'm right in saying that the public health approach was started in Lambeth under you a year ago.
I think we started exploring public health as an approach in 2015 was the first time we did some work, but we actually shaped that up properly in a cabinet report in March 2018. Yeah.
So you must have given thought then as to how you would prove that it was working, that it was delivering as a leader of a council. I know that's what I did. You think is money that's going into this being well spent. So given then that you firmed it, if you've been thinking about it since 2014, you must have been thinking since 2014 about how do we measure these various different things. So given that you must have been thinking about it since 2014, what measurables did you put in Lambeth when you actually put it in a year ago?
I'm sort of mindful of the earlier conversation about confusion of roles. I thought I'm here as a civil servant representing the violence
reduction unit. Yes, but we draw on our thought processes from beforehand.
Okay.
So given that...
Just wanted to check in, that's all, because I don't want to create the wrong perception.
No.
Yeah, okay.
We learn things at school and we can repeat them and we use them. So given that you've been thinking about this since 2014, what have you given in any roles that you've got? What thoughts have you given for delivery and how we measure that delivery?
Well, the lessons I learnt from Lambeth generally were the importance of the whole violence, the interrelationship between different forms of violence.
None of us disagree with that. We're looking at measurables and how you measure success.
Yeah.
What successes in that did you measure in Lambeth, or did the council measure in Lambeth?
Yes, we did measure successes, but and failures, and we didn't start in 2014. I mean, I said.
Sorry, I've got that date.
No, but I should be clear. No, that's fair enough. I said we started thinking about that. We actually took a paper to our cabinet in March 2018. So in terms of the things that we would assess, we would look at the work of the Violence Against Women and Girls programme, which we pioneered. We'd look at the amount of, for example, some of the referrals that came through from the community.
So what KPIs did you put in Lambeth? What KPIs did you put in so that you could measure whether it was successful or not?
Well, I mean, fairly traditional KPIs in terms of all of our work around the impact of crime in the borough of Lambeth. So we draw on, Metropolitan Police data, and we'd also
So you did measure it properly.
Sorry, do you want me to finish?
Well, I'm mindful that you're saying you've got to go. Yeah. We're very, very keen that we have things that are measurable, because there's millions and millions of pounds of taxpayers' money going into this, which is great because we're all agreed that we need something to reverse the situation we're in now. You were doing it in Lambeth, so obviously you've had thoughts about this for quite a long time, and given that thousands of pounds must have gone into it there, you must have had thoughts about how do you measure the success of a specific project that you're doing.
Yeah. Okay, so I go back to, I suppose, what I said originally, which was that there are different things that you could measure. Some of the things that we measured in Lambeth were around things like the amount of domestic abuse that was going on in the borough, but we also added to that by looking at the sustainability of certain projects through how many referrals came from the community and how many self-referrals there were, rather than just the number of people that went through the Gaia Centre. And that's kind of the approach that I would want to adopt here, which is a more well-rounded one, than just looking at, how many numbers have dropped in terms of, homicides over this particular period. I think you need to do some of that crunchy stuff alongside some of the stuff that I think indicates whether a project is reaching the right people, is having the right impact. And I think that blend of those two things, which was complicated enough in the London Borough of Lambeth, is going to be even more complicated when you start looking about it across London. So I know it's frustrating, but I'm not about to give, I'm afraid, a performance framework, because we genuinely haven't we haven't had the space or the time to be able to develop that. But those are the kind of things I would think of.
I think the problem is we're so used to not having things that are properly measurable from within knife crime strategies and everything else. We are keen to make sure that taxpayers' money is spent properly and with things that aren't just going to be talking shops or listening shops. We must make sure that we get good results from this sort of money that's being spent.
And I've heard that concern, and I still can't answer that question, but what I can do is say that all of my local authority experience, given that you were drawing on it, was around delivery. And that's a really important component. And when I've talked a lot about how people judge us, it will be about what we deliver. So I'm not in all complacent about the importance of having some measurables that are transparent and understood and really get us under the skin of what we're trying to tackle here, and can therefore use to good effect. But I can't answer the question in any more ways, I'm afraid.
It's a fair question, because if you're putting out public money out to organisations, those organisations are set targets because they are delivering public funding. So the committee, for the record, will expect KPIs and a performance framework, and we will scrutinise that. Now, we are moving on, but I saw Andrew, Caroline, and then I'll wrap up.
It's a very simple question. There are other questions I wanted to ask you. It's a bit of a bombshell to know that you've had to go so quickly now, but I still need to get the idea of when we're going to get the performance framework. When is that going to happen?
Okay. So I think, as I mentioned, we are looking first off to agree the work programme. We are then looking to put into place the commissioning framework, and obviously through both of those processes we'll start doing thinking
I
around
understand
the
the
performance
stages.
framework. Oh, sorry.
But
So
when?
well, that's
a date.
Well, I mean, I would assume, given that I've been given sort of each of those areas of programme work some time frame, I would assume that by July we are looking in a position of where we would have a much clearer idea around some of the performance framework measurements.
So July, and then presumably we will have the KPIs and measures for success by the time you've finished the performance framework.
That's what I meant by the performance framework. That's what you were saying.
Okay, thank you very much.
It seems to me from our discussion today that probably later in the year we'll want to have you back, ultimately subject to the chair, to talk through as you're getting into your work more and you're more sure about it all. Will you, through that work, really strengthen what you're doing around domestic violence, vulnerable adults? Because though it's been mentioned, everything always comes back to young people, even the community representatives. It's all about young people, and I'm not saying young people don't experience domestic violence, but it feels to me that strain of work is pushed back. And also, I couldn't find it in our paperwork, Chair, but we discussed it beforehand, the issue that a lot of, and I can't remember the figure, a lot of these tragic deaths on the street are over 25-year-olds, they're not under 25-year-olds. I think in your papers you're focusing on under 25-year-olds. It's just how you get that balance, because you're there, as you've said, for all violent crime, but it feels to me the dialogue always goes back to young people. I'm not saying that's not important, but we want the focus elsewhere as well.
No, I mean, as I said before, I recognise that challenge, and I completely agree with the premise of your question. Therefore, yes, I would very much hope that it is much more evident when I come back sort of later in the year. Yeah.
Great, thank you.
And I'm also very happy and interested to hear, your thoughts in advance of that. I'm quite genuine in I've had some constructive conversations with people around the table who did indicate they wanted to meet with me in advance of this, and I'm very happy to do so, because I do genuinely believe it's an incredibly complex area, and the more brains you have on it and the more common endeavour you have behind it, the better you're going to end up doing.
Okay, again, thank you, Lib. The committee obviously will take a very keen interest as this evolves. You've heard that already. I'm sure my colleagues in Croydon will be deeply upset that their plans to annex all of South East London are now up the kibosh, and they won't be able to take over all the VRUs in Lewisham and everywhere else. That's interesting. Right, so again, can I thank you? Can the committee delegate authority to the chair of the committee, whoever that may be at a particular time, to agree an outcome? Item 8, can ask the committee to note the summary of the work programme 18-19, note our provisional dates for 19-20, note the topics for our May and June thematics, and agree a general delegation to me in relation to urgent matters for all the 3 days, probably. Item 9, date of next meeting, subject to the Assembly agreeing the calendar of meetings in a couple of days' time. The next meeting is scheduled for the 14th of May at 10 a.m. I have no other urgent business, but I would like to thank everyone for their support, both officers and members and guests, during my tenure as chair, and I look forward to working with the incoming chair for the coming year.
And Chair, sorry, and can I, on behalf of my colleagues, also thank you for the way you chaired the committee for the last 3 years.
Thank you. Thank you. Appreciate it. Thank you.
GLA Committee Room